COPD stands for chronic obstructive pulmonary disease. Let's clarify what this means. If we dissect this name, we can understand the condition very well. Chronic stands for a long-term condition. Obstructive refers to a blockage, an obstruction to breathing. Pulmonary disease refers to a condition affecting the lungs. Therefore, COPD is a condition in which there is a blockage in the flow of air from the lungs. More specifically, patients who suffer with COPD have difficulties getting the air out of their lungs fast enough. This is key, not being able to breathe all the air out fast enough. At rest, this may not present a problem. However, once a person with COPD starts to exercise or even walk faster or longer, their breathing rate increases. Each breath is obviously shorter and therefore there is less time to get the air out between breaths. If the obstruction is quite severe, the lungs trap more and more air as breathing accelerates. Eventually, there is very little room for inhaling air and the person needs to stop and rest to slowly empty their lungs of air before continuing their activity. COPD generally occurs after the age of 40 to 50 in individuals who smoked for many years. Some people have a predisposition to developing COPD with less exposure to smoke or environmental fumes. COPD is diagnosed on the basis of typical symptoms such as shortness of breath and chronic cough. Coughing in COPD is generally wet, productive, and does not seem to go away. Some patients may refer to this as smoker's cough. A spirometry, a simple breathing test, is required to confirm airway obstruction to quantify if the flow of air is obstructed. Treatment for COPD is generally with inhalers. Modern inhalers have long durations of action and in many cases only need to be used once daily to significantly improve symptoms. Other conditions which may be associated with COPD also need to be treated in order to better manage overall health. In severe cases, oxygen therapy may be required long-term, as the lungs are no longer able to supply normal blood levels of oxygen. However, by discovering COPD early and stopping smoking or other exposures to noxious fumes, the condition can be controlled quite well. I recommend seeing your doctor early if you suspect that you are having COPD or have any breathing difficulties.